Well, thank you everyone for joining us today for our weekly virtual press briefing. Today is January 13th. As of today, the city continues to be in phase 3 of Governor Northam's Ford, Virginia plan, his plan on reopening. And as always, you can learn more about what that means for the city of Richmond by visiting us at rvastrong.org/reopening guidance. As of today, the Richmond City Health District is reporting 10,698 total positive cases of COVID-19 since the beginning of the pandemic. Let me repeat, 10,698 total cases. We have certainly crossed the 10,000 threshold, and I think that is meaningful. It is a significant amount of positive cases we've had over the course of not just 2020, but as we began 2021 as well. Also, 116 Richmond residents have lost their lives due to COVID-19. 116 Richmond residents are no longer with us because of the novel coronavirus. I want to, per usual, take a moment of silence so we can remember those we've lost within this pandemic. Thank you. Just a reminder, if you traveled over the holidays, it is incumbent upon you to monitor yourself for any symptoms and to get tested if you develop any symptoms. You have many testing options available through the Richmond City Health District. Those options available over the course of the next week, which are always free. We have tomorrow, January 14th, from 1 to 3 p.m. at the Broad Rock Community Center, 1 to 3 p.m. at the Broad Rock Community Center. And then Friday, January 15th, from 1 to 3 p.m. at the Eastern Henrico Health Department. That will be a drive-through event. So again, let me repeat, free testing available tomorrow, January 14th, 1 to 3, down in Broad Rock, the Broad Rock Community Center. And there's a drive-through testing event on Friday, 1 to 3 p.m. at the Eastern Henrico Health Department. To bring us up to date on the city's current health status, we are joined today by Dr. Melissa Viray. She's going to give us an update. Dr. Viray.
Thank you, Mayor Stoney. I want to echo what Mayor Stoney said, that it is, we are seeing unprecedented numbers in the wake of the holiday season here in Richmond City. We are perhaps not racing upwards in the same way that we were earlier this month, but we continue to stay extraordinarily high in terms of our numbers of our new cases, up to a daily average of 116 new cases a day, meaning more than 100 cases coming in every day with coronavirus in our city. We are seeing clusters in our workplaces. We are seeing exposures in gatherings and in homes. We are starting to see the impact of coronavirus again in our long-term care facilities, which we know once it's in our long-term care facilities, we know it's difficult to eradicate. Hospitals and ICUs are also in the metro region are continuing to see overall increases. So right now, there is an ongoing need to stay socially distant and to continue to wear your mask when you're out around others, and to maintain the social distancing rules that we have been trying to maintain since last year until we're able to get a sufficient number of individuals vaccinated. But on that note, and on a happier note, on a positive note regarding vaccination, we in Richmond City continue alongside Henrico County, the health district, we continue to be right now in phase 1A of vaccination for coronavirus. That is our healthcare workers, our front-facing healthcare workers, and our long-term care facility residents. Between our healthcare systems, our pharmacy partners in the long-term care sector, our provider partners, and our own local health district, we've put out some 37,000 vaccines through our varied partnerships. Now, remember that this is not going to match exactly what you see on the VDH dashboard, because some of these individuals don't actually live in Richmond City, but they work in Richmond City or Henrico County. And then some of our providers aren't able to necessarily get everything uploaded into our vaccine registry right away. So that number is going to lag a little bit behind what we're seeing on the front lines. But either way, the good news overall is that we are getting vaccine into arms in our city. You may have seen last week the announcement that some regions of Virginia were moving into the next phase of vaccination. That's phase 1B, our frontline essential workers and those who are 75 and older. And we announced today that Richmond City Health District, Henrico County Health District, Chesterfield Health District, and Chickahominy Health District, we are opening up 1B vaccination this coming Monday, January 18th. So while we will be continuing our 1A vaccination efforts, and that will be an ongoing effort, we are aware that we have partners who are poised to start 1B, and we and those partners don't want to necessarily hold that potential for vaccination back. So these efforts for 1B as we open up will be targeted at our 75-year-old citizens and older, our correctional facility inmates and our homeless shelter residents, and the first three groups of frontline essential workers, that's police and hazmat, our correctional facility workers and homeless shelter workers, and childcare and K through 12 throughout the Richmond metro region. And we're going to be doing this through a combination of large regional events and pharmacy agreements, provider agreements, different providers out in the pharmacy, different practices in the different practices in the community, and we at our local health district sites. Right now, we have 3 large regional events coming up in this coming week. Again, this is all starting after this. This is all starting next week. And then 4 events through our local health district, Richmond and Henrico, with over a total of 7 events just through the Richmond City and regional events alone. We're anticipating maybe 8,000-ish vaccinations in this coming week. And we are working with employers like school systems, the police departments, to get these employees, these frontline folks registered for these events. So we ask that if you don't have an appointment, to not go to a location until we've set you up for an appointment. Regarding our other communities are 75 plus, and our correctional facility residents or inmates. More will be coming in between now and Monday, so individuals can understand where it is that they should be expecting to see vaccination coming as we open up slowly for 1B starting on Monday. One last thing I wanted to add is that in addition, regardless of whether or not you're in one of those first 3 groups of 1B, we are, we have an intake or an interest form on our website, that rchd.com, that will allow you to connect with us if we haven't already connected with you, or if you're not connected with your employer and you think you might be in a phase 1A or phase 1B vaccination category, reach out to us through those forms so that we can connect with you and talk with you about your vaccine eligibility for this for either now or in coming weeks. And I think those are the big updates for right now, unless individuals have questions.
And Dr. Viray will do questions at the end. And thank you for that update. And obviously, the number of total cases we've had in the city of Richmond over the course of this period of time is concerning. It's concerning to I know the health department, and also concerned to us here at the city as well. But it's always good to hear that the vaccination process is moving on, and we're about to enter a new phase, and we're going to get more shots into more arms, and that's a positive that I think we can embrace at this moment in time. Also joining us today is another one of our great public servants, that's Mr. Jason Kamras, the Superintendent of Richmond Public Schools. Mr. Kamras will give an update on the status of our public education system. Mr. Kamras.
Thank you so much, Mr. Mayor. Just a few brief updates today. First, I just want to thank the VDH for their leadership in moving so swiftly with the vaccine operations, and particularly with phase 1B. I do want to note all RPS employees are eligible under Phase 1B. And so we are working in close collaboration with VDH to establish timelines and details for that. We will likely begin with the staff that are in person, even though we are virtual this semester, our bus drivers, nutrition workers, some office and administrative staff who interact with the public, and then go from there. But again, thank you so much to the VDH, Dr. Viray, and obviously Dr. Abula for all of their partnership in figuring out this very complex endeavor. Second, as I shared yesterday, great news on the financial front. We received word that RPS will be receiving $54.6 million from the recent federal stimulus package that was passed just before the holidays. A few notes about those funds. One, obviously, we need to spend them on our response to COVID, everything from facility enhancements to responding to academic and social and emotional issues that have arisen over the course of this year. I do want to note that the funds are not to be used for raises and bonuses, though of course we would like to give as much as we possibly can to our teachers and other staff. I do want to note that is one stipulation. And then also these funds are one-time funds, meaning once they're spent, they're gone. So unlike the generous investments that the mayor and the city have made in RPS, which are recurring investments, which allow us to hire teachers and other folks, these are one-time investments. So we're going to have to be thoughtful about how we spend them. I will be presenting a budget on Tuesday to the school board, and our focus will be responding to COVID-19 with three big buckets. One, likely an extended year proposal that will add instructional time for our students, and particularly those who have fallen the furthest behind. Two, additional social and emotional supports. We know the toll of COVID has been significant, particularly where kids are remote for as long as they are here in Richmond. And then three, some facility enhancements to address air quality and other issues so that we can come back with healthy and safe environments for our kids. Last, just again, thank you to everyone, in particular our teachers and staff and families out there who I know continue to work so hard to make our virtual year a success, and we are incredibly grateful. So thank you.
Thank you so much, Mr. Kamras, for the update. And also, I just want to take a moment of personal privilege and just once again thank you, your leadership team, how you all have navigated these most challenging times during COVID-19 and this pandemic. I know it's been difficult, but you've worked more than your 8-hour day for the last year plus. But also, you've been I would say, a breath of fresh air for our system. And so please continue the hard work. I know there's a lot happening out there at the school board level. I want to say, sign me up as a supporter and ensuring that you stay here for another 4 years. I think you've been a champion, not just for the educators in Richmond Public School, but also for our children and our families. And I think we deserve that sort of leadership for the long term. So sign me up as a supporter and as an ally as we continue our work to ensure that our kids get the best education, even in this most challenging time.
Thank you so much, Mayor.
Thank you. Thank you. I wanted to also take a moment to talk a little bit about, this being such a challenging time and us as a city doing our best to help those manage this very, very difficult time in the city's history. There's a couple of economic relief opportunities that we have stood up to continue to help those who need the help the most. On Monday, we had our first round of pickups of PPE kits for small businesses. You can still sign up for a kit at rvastrong.org/PPE kits. Once again, rvastrong.org/PPE kits. The last pickup opportunity actually is tomorrow from 9 a.m. to 5 p.m. Please go to the website. And if you know someone who needs a little help with PPE to continue the operation of their small business, please direct them to rvastrong.org/PPE kits. Additionally, we're also offering relief for anyone who has fallen behind on utility bills since the start of the pandemic. If you've fallen behind on your city water, your wastewater, storm, or your natural gas bill, you may qualify for some help. We ask that you apply by Sunday at rva.gov slash public hyphen utilities. That's rva.gov slash public hyphen utilities for those who may need some relief with their utility bills. And of course, as you may have heard earlier in the week, Council and I have worked together to create a tax amnesty option for those who have racked up any penalties and interest on real estate taxes and admission, lodging, and meals taxes. So real estate, admissions, lodging, meals taxes. If you've racked up any of these fees or penalties on any of these items, there will be amnesty available to you. The council will vote on January 25th on this opportunity. So I ask that you stay tuned when the application and other program details will be made available. I want to also thank the City Council and the Finance Department for working on this option to ensure that our residents can navigate this most difficult time. All these programs that we've offered during the pandemic are rooted in our desire to provide compassionate care and support to our residents, because it is very clear that the effects of 2020 are following us, unfortunately, into 2021, and these effects are real. There are obviously a number of effects that deal with our world in terms of human services, but also fiscally as well. Local governments, as you all may know, serve as the first line of defense against the economic effects of this pandemic. Unemployment, food insecurity, housing insecurity, you name it, local governments are on that front line. But I want you also to know this as well. As always, we will do more with less during this budget season. But the pandemic has undeniably taken a toll on our coffers, and we need to be cognizant of that as well. And that's why I want to speak to you about today. The city received roughly $40 million in CARES Act funds in the middle part of 2020. And we delivered that money back to the people in the form of vital support programs, from small business grants to rent relief, to ensure that people stayed in their homes and we can keep businesses open as much as possible. However, the most recent federal stimulus package does not include any funds for localities, no funding for local governments. I'm incredibly grateful that it is so generous to our schools. Obviously, you heard that Mr. Kamras talk about the gift that the federal government is providing him, so we can ensure that our kids still get a quality education in these most difficult times. But there is still a broad swath of needs that localities can only meet with adequate support up the ladder. I will repeat again, we need more federal support. We need more federal support to weather this storm that's still ongoing, even in 2021. There's certainly a light at the end of the tunnel with the vaccine on the horizon, the vaccine already getting into some arms around the city. But because of the economic effects of the pandemic aren't going away anytime soon, the truth is the residents of the city of Richmond will turn to City Hall for more help, and we simply just want to help them. Obviously, city governments, local governments cannot do it by ourselves. We're going to need some help from the federal government. So to our friends at the state level, our friends at the federal level, it's a long road to recovery. Now is the time for you all, the state and federal level, to step up for local governments who serve on that front line. And with that, we'll open it up to questions. Sam?
Thank you, sir. Let's begin with Alan from VPM.
Hey, thank you. My first question is for Dr. Viray. We've heard from, in other states, we've seen reports that some medical workers have been declining the COVID-19 vaccine. I'm wondering if we're seeing that here locally in Richmond and Henrico, if we're keeping track of those numbers, and if you could kind of just comment on why that may be.
I think I don't have those numbers in front of me. I know that our partners, each of our healthcare systems is keeping track of that, but I don't have formal numbers right in front of me right now. I think there's a couple of different reasons why we might see why we might see vaccine hesitancy, even in our healthcare worker community. Even I know that while we have definitely seen parts of the healthcare system very, very excited to get vaccine, a lot of folks, our healthcare workers, are just like everyone else. They're concerned about the same things that a lot of folks in the community are concerned about. And we've been trying to work with them on the fact that it is a safe vaccine. They didn't take any shortcuts. It's a safe and efficacious vaccine, but some of them may just have the same hesitations that folks out who aren't in healthcare have. And I think it's important to give people that space to make a decision and not be pressured. I am hoping that they will ultimately elect to be vaccinated. And I think that as we see uptake from this first set of vaccinations, that first 50 or 60% who did elect to get vaccinated, I think we might see more folks seeing that the side effects were not that bad, that it is something that they know people who have had it, and it's a little more reassuring. And I think we just need to give it a little bit of time and continue to reassure folks that yes, as a healthcare worker in 1A, you are still eligible for vaccine. And so we hope you take advantage of it, no matter when you come to that decision that you're willing to take it.
Great, thank you. And then one question also for Superintendent Kamras. We've seen in Henrico and Chesterfield that the districts are sending out surveys to teachers and staff to gauge their interest in the vaccine. Is Richmond Schools doing that as well for their staff?
Well, I do think there's a little bit of a difference between Chesterfield and Henrico and RPS in that both Chesterfield and Henrico have some version of in-person instruction occurring. And so I think they're trying to align their vaccination efforts with that. Whereas here in Richmond, we are fully virtual for the rest of the school year. And so our goal is to work with VDH to make the vaccine available to all of our staff over the next several weeks, months, and ultimately get everybody vaccinated prior to our in-person start this late summer or fall.
Got it. So no survey then for staff?
Not at this point, again, because our vaccine will ultimately be available to everyone. And so there's no need to assess how much uptake there's going to be, as we are not going to be in person for the spring semester.
Got it. Thank you.
Thank you. Okay, Alex from Channel 8.
Hey, my question is for Dr. Viray. Pull it up here. So I don't want to ask you to predict the future, but I'm wondering if there's any idea when the rest of 1B will be eligible for the vaccine in our area. I'm talking, grocery workers and such. And then also wondering, I know you said more information is going to be coming out for that population 75 and up, but that is just one of the biggest questions we're getting is those people contacting us. What can we do? Where can I sign up? So is there anything that we can tell them today as far as anything that they can do to help move this process along?
Okay. I'll start with your first question. And that is that we do anticipate not sitting for too long in the early stages of phase 1B. I would anticipate moving through or continuing to add on elements of the essential worker categories as weeks go by. So I would say we're not going to be sitting here for months and months. I anticipate adding them on in coming weeks. I can't necessarily prognosticate more than that because it depends a little bit on uptake and how that goes. But I think I would not anticipate waiting very long for the rest of 1B. Regarding our 75 plus, part of the reason I'm holding off is because I'm waiting to make sure that we have our ducks in a row before I make any big statements. I do think that it's one of the things that will be good if we could just, I know that you guys are getting a deluge of questions. We are too, from our 75 plus year olds. I think it is fair to say that we are working with a large partner to arrange for widely accessible vaccinations for our 75 plus. And that right now, until I have that finalized, and that will be finalized this week, I just don't want to say any more than that, other than to say we are working with regionally with a partner to work on getting access for our 75 plusers. And if that falls through, we'll do through the health district. It's going to be one of those things that it is, we know that this needs to be vaccinated, but I just don't want to set thing. I want to make sure that I've got all of my ducks lined up before we say go this way, because I don't want to send somebody to one place and then have to send them somewhere else. So give me a little more time. I know that people are anxious about it, but a little more time to line our ducks up, finalize some contracts, or finalize some arrangements so that we can tell people where they're supposed to go and just have the most direct line to vaccination possible.
Okay, thank you.
Thank you, Alex. Chris from RTD.
Oh, sorry, can I, before Chris goes, one other thing is, this is not necessarily mutually exclusive with that thing that I'm going to be talking about later this week. But if for whatever reason you are 75 plus and you're concerned and you want to make sure that you're counted and you're accounted for, that form that I mentioned at rchd.com, that vax intake or interest form, go ahead and fill that out. Go ahead and get your name in with us. If and we can just, and you might get pinged twice, then you might get pinged once for this one thing and one, but you might get pinged more than once for vaccine, but that's okay. Go ahead and fill that out. Let us know that you are concerned, and we'll try to make sure that one way or the other, we connect you to vaccine. Sorry, go ahead.
Chris?
Yes, thank you. So two questions. First for Dr. Viray. How is the city, the health department planning to prioritize which school teachers, for the different districts? We'll get it first. I think, Alan's question about RPS, remaining closed through the spring. But how about, police officers and other frontline workers for the different jurisdictions? How's that all being prioritized?
Sure. So on one of the, it's a hard decision, right? All of these people need vaccine. And it's just one of those issues where while we're constrained by allocations, we just need to have a prioritization tiering. The guidance the tiering that we're using right now is based on VDH's website. They have a phase 1B in-depth where they kind of lay out when you have limited vaccine supply or you have to walk things out step by step. This is the order in which we prefer that you try to think about your planning. We're not holding hard and fast to say that, we have to complete this first category before going to the next category. But in terms of as we roll things out in our planning, we're keeping this list in mind, and it starts with police, fire, and hazmat. Then it goes to corrections and homeless shelter staff. Then it goes to childcare and K through 12 teachers. And then it moves on from there through food and ag and the subsequent categories. And that's the overall gist that we'll be using to guide our planning for purposes. Although we won't necessarily wait to finish all of one category before we go to the next category. But that's how we are. And when we're talking to the police folks, when we're talking to RPS, when we're going to be talking to other employers, one of the things we ask them is, we really want to make sure your public facing, your front facing, your student facing individuals are the ones we get to first. These are the folks at higher risk for exposure to COVID-19. And these are the ones that we want to make sure that we get in first. The folks who are teleworking, the folks who are able to fully do their duties remotely are not necessarily as high priority as those who don't have a choice. And where we have critical infrastructure that we cannot put in place because of that lack, that's where, if, for example, with regards to RPS, they aren't going to be able to be in person right now. And so part of that might be assuaged and part of that might be helped by getting their front facing folks vaccinated. And so that's part of this prioritization is this, how do we get the folks who are by duty in front of the public, in front of, interfacing with folks on a daily basis? How do we make sure we get them vaccinated first? And so that's how we're approaching these as we go down through these categories. Does that help?
Yeah. But I guess also just to clarify as well, is these 4 different events, I'm assuming that everyone that's eligible that they've already kind of set up appointments or are being invited
We
to?
are it's ongoing. So remember that this isn't this week. It's this is an ongoing. We're working with those employers now, and it's not necessarily a you first then you. It's kind of a, hey folks, these are opening up. What kinds of scheduling can we put together? So we're not necessarily doing one before the other. We're doing for in this category of 3. We are addressing the correctional and the homeless shelter employees through a different mechanism but for our police, our hazmat, our K through 12 and our K through 12 folks, we are working with those primarily through this regional event setups that we're doing. And then we're also on the back end through also doing some of these smaller ones, for example, in our private schools, some of our daycares, those might come through our not through those big regional events, those might come through some of our still rather large, but not regional local events that are also occurring as well. So it's a combination of all of the above.
Chris, you had a second question?
Yes, and then for Kamras, you mentioned that there's new federal aid that has been allocated from this recent package. Last week, news was reported that the city's emergency childcare program is about to run out of money. Do you foresee that you might ask, or the school board might consider allocating some of those funds to help kind of bridge the gap for the rest of the school year?
Yes, I will be proposing that given our stimulus funding, that we take on that funding responsibility for the rest of the school year.
Thank you.
Enzo? Enzo Domingo from Channel 12.
Yep, sorry about that. Had a problem with my microphone. This question is for Dr. Viray. Doctor, in terms of the eligibility, say there's a person that works in the city of Richmond or, Chesterfield, Henrico, but they live over in a district outside of the ones moving on to phase 1B, like Petersburg, for example. Would they be eligible because they work in the city, or how would that work out for people that live outside?
No, I think one of the things that we saw this in 1A actually is that we found that a fair number of our folks who worked in Richmond, in particular in Richmond, because we are such a big employer in Richmond City, a fair number of them lived in Charlottesville or in Virginia Beach, further away than I expected. And the heart of it is to get vaccine in arms. We are not, while we intended primarily for those who work and live in this region, we understand that some may work in this region or primarily work in this region, but may live and commute during the week. And so we are really, we're not going to say, oh, well, you live in Crater or you live in Petersburg, so no, we can't have you here. We're really more looking at getting vaccine into arms than we are saying, oh, but where do you live? Do you live in Richmond? It's really about where do you work or where do you live? Not or.
Got it. Thank you.
Thanks, Enzo. Okay, we'll close it out with Cam Thompson.
Thank you. And for Dr. Viray, it's sort of a follow-up to Enzo's question, just about clarifying, as you said, working versus living for the 75 and older. That is that going to be rather clear cut of someone living in a certain district? And I guess how do you go what sort of level of documentation or checking people in terms of that they are in one of these areas or do meet the current criteria will be in effect as we go forward in this phase?
This is a tough one because what we've seen already happen is that when we have districts where there is 75 plus vaccination going on and we have districts where there's not, obviously folks who are in the adjacent districts are going to want to come to the ones where we have. I do think we have, with this regional approach that we have right now, it will cover, what we're looking at is that it should allow at least the folks in our region to have enough overlap so that we're not looking at competing, people trying to go to a neighboring district to get their vaccination. We are encouraging, we are going to check age, but that's an easy enough thing to do. We are strongly encouraging folks to be residents of our metro region, but we are not, as long as the vaccine supply allows, and this is a critical amendment here, as long as the vaccine supply allows, we would like to prioritize vaccine in arms for those who are 75 and older. I am not saying, come from all over the state, because that may compromise our ability to vaccinate those in our metro area. So I'm asking, and since there are a number of areas in the state that are already open up to 1B, that opened up this week, we're hoping that the demand will be spread out across multiple areas of the state. But we're really more about getting vaccine in arms more than anything else, as long as the vaccine supply allows.
Thank you, Dr. Viray. It looks like we've gotten through everyone's questions. Thank you guys for asking questions.
Yes, thank you, Sam, for conducting, and thank you, Dr. Viray. Thank you, Mr. Kamras, and thank you to our friends at the media as well, press and media. Thank you for joining us today. Have a safe one. Take care.